John Rother is the Executive Vice President of Policy, Strategy, and International Affairs. Does that leave something else for somebody else, John? At AARP, he understands this argument and the entitlement piece of this argument as well, and has been at it as long as anybody in Washington. Ryan Schoenke? Schinneke, okay. Co-founder of Young Americans for Federal Debt Awareness, seeks to educate the millennials about the consequences of continued deficits. In my experience, a group that completely gets it and is very willing to be engaged. So I'm interested in hearing more about what you have to say about that. And Deborah is it Steen or Stein? Weinstein, formerly of the Children's Defense Fund, now Executive Director of the Coalition for Human Needs. So we'll hear first from John.
Thank you, Ruth, and I'd like to acknowledge the good work that the committee is doing under my friend's direction. I'd like to, build on the comments from the first panel. I certainly agree that we need a course change in public spending, but I also want to remind everyone that deficit reduction done poorly could hurt more than it could help. So I think, we certainly support action, but everything depends on how we go about this and what the main policies are. I'd also like, just as an opening, to remember that it's not just growth that's important. Growth is important, but so is personal economic security, and so is quality of life. And when we talk to our members around the country, or we do polling, often those are just as high priorities as is economic growth. We sometimes forget that personal security and quality of life are what are really important to most Americans. So I think we identified some of the main points already that I would like to make. The first, of course, is that asking for sacrifice depends on two things. Number one, do people feel like they can sacrifice? And two, do they feel that it's fair? And today, many people, not just older people, have been traumatized in recent years. Lost jobs, drop in equity markets, drop in home equity values, really scared about their prospects for secure retirement. Many people in their late 50s, early 60s, out of work, no reasonable prospect of finding a job. They're taking early Social Security benefits in record numbers, and they're looking at inadequate income for the rest of their lives. And it's a scary time. And so I think it's a difficult time to ask for sacrifice. I think the issue of fairness comes down to, Andy referred to it earlier, the growing gap between the well-off and the middle class is quite evident to the public. And a call for sacrifice that doesn't go first to the well-off would be rejected by most Americans. And when we look at the tax code, for example, and the spending through the tax code, most of that money goes to people in high brackets. Most of the money. When we look at agricultural subsidies, most of the money goes to large, very profitable agribusiness, not the family farmer. We need to be clearly asking those who are higher income to sacrifice first if we want to present any kind of deficit reduction plan that the public will feel is fair. Now, I do have a lot to say about health care. I'll be brief. Health care, in my mind, is the Pac-Man that's eating up not just the federal budget, but state budgets, business budgets, and family budgets. There's a reason that wages in this country for most people have not improved in the last 10 or 15 years, and that's the growing cost of health care. Health care is so out of line in this country with the rest of the world that it's absolutely the thing that needs the greatest attention and has the greatest potential to help our long-term fiscal situation. It's not just Medicare. Medicare's situation is simply a symptom of what's happening across the board in healthcare. It's affecting corporate, it's affecting personal budgets, and it's certainly affecting retirees. Medicare is actually pretty thin benefit-wise. It's much less generous than most employer-based healthcare programs. There are not too many other healthcare programs where you have to buy a supplement in order to protect yourself from truly large expenses. The Affordable Care Act was an important start, not sufficient, but it laid the groundwork for what we have to do. But what's happening recently in the Congress is certainly a discouraging development. I saw yesterday several congressmen were on record as opposing the Independent Payment Advisory Board, the key to long-term sustainability in Medicare. And you know, if we start defunding it, if we start repealing these key elements, then we are in for truly healthcare crisis, not just in access and quality, but in terms of its impact on the rest of the budget. Finally, I need to say something about Social Security, just because, you know, I'm from AARP, so Social Security is our program. And Social Security is probably the easiest long-term issue in my mind to address. When we ask our own members, or my board, or public at large, here are some options for addressing Social Security's long-term. See if you can pick several elements, put them together, and then see if you can get your colleagues to agree. It takes about half an hour. This is not hard. And almost all people rely more heavily on revenue than on benefit changes, but there are some benefit changes. And certainly there are things that we could support as AARP, but I don't know why it seems to be difficult to do that. My guess is it's because Social Security has lately been raised in the context of deficit reduction. And if we know one thing, we know that the American public does not see Social Security as part of the deficit. Now, you can argue whether it is or it isn't, but Social Security, if it's presented as a standalone program with its own funding that faces a long-term challenge, the American people will agree and say, okay, let's do what we need to do to address it. And addressing it will help the deficit long-term. But if Social Security is lumped in with everything else short-term and say, you know, we have to do this because we have a deficit, then you're looking at about 80 to 85% opposition in the public. And the public just does not see it that way. And, you know, I understand the arguments for looking at the entire range of spending and entire range of income, but the public does not see it that way. And so we have to be careful how we go about addressing these if we're going to be successful. So a lot more to say later, but I hope that gets us off to a start.
You know, so often today we talk about the debt in terms of cuts and sacrifices, and where are we going to cut and who's going to have to sacrifice. But I think really to understand the view of my generation, the millennial generation, those 18 to 32 right now, we have to look at the economy as a whole. And I really want for the next few minutes to shift your thinking in terms of investment and not cuts and sacrifices. Because right now, Congress is really talking about 12% of the budget. They're only looking at cutting on the investment side. And these are the areas we need to be spending on so that we have the money and the revenue to pay down the debt we've already built up. So I'd like to just start off by talking about where we are now, talk about the challenges we'll be facing, a little bit about investment, and then wrap it up with a little bit about growth and innovation. So America today, I think we all know the story of where America is today. Growth is low, debt is high, a lot of people out of work. A couple things I do want to point out, and that's in terms of a dollar amount. GDP last year was about $14.7 trillion. We're looking right now at a debt of about $14.2 trillion. That's when you take everything into account. So really, we're almost at that 100% debt to GDP ratio. And for my generation in particular, we've got a lot of people out of work, about 7% above the national average at 17%. So this is the budget as projected by the current administration in 2020. One thing I wanted to point out about this is interest. We've heard some other people talk about interest today, but it went down from $1 trillion last year to 840 projected this year. Now, it seems a little bit unrealistic to me. We don't yet have a plan in place to deal with our debt. We continue to spend more money, so I believe eventually the rest of the world is going to say enough is enough and signal that to us with higher yields on our bonds. 2025, we've got a lot of estimates showing that revenues are going to be equal to Social Security plus Medicare and Medicaid and plus interest. And so that means that everything else we do, education, transportation, infrastructure, that's all going to be borrowed money. And that's not a good situation for my generation to be in. So just want to move on to some of the challenges that I think we'll be facing, challenges outside of the debt, challenges that are going to be compounded by the debt. The first one is resources. The middle class around the world is growing, and they want more resources. So right here, what this is a picture of biocapacity. Now, biocapacity is a given area's ability to take in the waste generated by the people on it and reproduce the resources that they take out of it. And so what you'll notice here is that both the U.S. and China are darker shades of red. We're about 100 to 150% over our biocapacity. And so in a resource-constrained world, prices are going up. This is a picture of what happened to commodities last year. 92% increase in corn, 44% in soybeans, 162% in cotton. In fact, just last week, the United Nations Food and Agricultural Organization announced that food prices are the highest since they began tracking them in 1990. Water, according to McKinsey, demand for water could outstrip our sustainable supply by 40% in 2030. And so the point of this is, how is my generation going to be able to afford the increased cost of everything we do, everything we consume, while maybe paying 50 to 60% taxes, because that is a situation we could be looking at if we do nothing about the debt. And so education is getting expensive, not only important to us in terms of what we're paying, but we're going to be paying for our children's education. So you can see right here that education over the past 10 years on average increased 5.6% above the rate of inflation. All taken together, the cost of education doubles every 9 years. And so moving on to another challenge we'll be facing, and that's competition from around the world. Millennials are going to see competition like America has never seen before. Brazil, Russia, India, China, they all want to live like us, and they all want the jobs that we have. And so to give you an idea of how fast things are changing, this is a graph here that shows the top 20 banks in the world by market capitalization in 2006. You'll notice that the top 2 are American, and in fact 7 of the top 20 are American. Not one place in here is a Chinese. Do you see a Chinese bank? 2009, top 3 banks are Chinese. Now, a lot of factors have gone into this, but this really shows you how fast the world around us is changing, and we're going to have to change if we want to keep up with it. And so investment, a lot of people have mentioned investment here, and it was sort of what I wanted to give you to shift your thinking about. And how are we going to invest? How are we going to create growth in the future? How are we going to have jobs? How are we going to have a tax base to pay down what we already owe? And so here's a picture of what lack of investment gets you. This is education in the U.S. We ranked 25th in math, 21st in science, even our best and brightest, our top 25, ranked 23rd out of 29 developed countries. This is directly linked to our decrease of investment in education. In the 1960s, we spent about 20% of the budget on health and education for children. Now we spend about 10%, and it's going down every year. And so what's the value of education? What does it mean to have a well-educated workforce? Well, according to Robert Fogel, Nobel Prize-winning economist, University of Chicago, a high school worker is 1.8 times as productive, and a college graduate is 3 times as productive as someone with a 9th grade education. You can see that there, but. And so when we're looking at cutting right now, this 12% of the budget, this investment side, which education is a part of, we really ought to think about what's the return on our dollar and what is that going to get us? And what do we want our workforce to look like in the future? Clean energy, a lot of people talk about this is the next big growth market. And so what does it look like right now? Well, $243 billion invested worldwide in 2010, up from $186 billion the year before. 2010 investment in China was up 30%. Distributed solar investment in Europe up 91%. By 2020, we are looking at a market that's going to be around $500 billion a year. And so what does this mean? Well, if you'll notice a couple of things, the countries and the areas I've highlighted, none of them are America. The investment, the innovation, it's not taking place here. And so no matter what you're hearing from politicians, what they're saying they want to do, this is the reality of the situation. Here we are, the wealthiest, most innovative country in the world, and we're behind in the next big market in innovation. So other countries are investing. Just quickly, China going to increase their investments in Africa by 70%. And it's not just China. It's countries all around the world. They're investing in education. They're investing in R&D. They're investing in infrastructure. And so how are we going to compete when the only thing we can focus on is cutting 12% of the budget? We can't even talk about entitlements. We're going to cut the very same areas that everybody else is increasing investment in. And so really brings me to our next point, and that is, how are we going to pay for this debt? At the end of the day, we still owe $14 trillion. We have to continuously fund our entitlements to keep them going. So what are we going to do? We can reform entitlements, we can reform taxes, and we can invest in future growth. And we're going to have to. There's not going to be a choice. And so moving on to growth, what does America look like over the next 10 years? Well, it looks like about 3%. And based on historical averages, China probably around 10, India around 8. And so we're going to have to change our game plan if we want to keep up with them. And like I said before, the middle class is growing. We add 70 million people a year worldwide to the middle class. This is a tremendous, tremendous opportunity for our country. It's a great opportunity for us to sell to the rest of the world. And I know you're probably thinking, well, Ryan, we don't really make that much here anymore. Well, we might not make as much as we used to, but we are innovative. We're very innovative. And I think this is a great example of innovation. Apple, $65 billion in revenue in 2010. $45 billion of that comes from products created in the past 10 years, products that did not exist 10 years ago. And so you might be thinking, well, that's all made in China. They're probably taking all that money. Not true. Only 5 to 7% of the final price is in a manufacturing cost of any given Apple product. And so finally, to close up, we've been talking about innovation and investment. Actually, today, in 1876, Alexander Graham Bell made the first successful phone call. He was an immigrant, an American immigrant. He came here because he could be innovative here. He could pursue his passion. And that's our legacy today. We're innovative. And I would hate to see us lose that because we can't deal with our debt and because the only thing we can do is talk about the 12% of the budget that's going to help us create growth for the future. So that's it. Thank you.
Good morning. I hope that somebody can find my slides. Well, I think that actually isn't it. There is I believe the presentation, the title of it was the high cost. Did you? Okay, this is a speaker's nightmare. I'm Debbie Weinstein. I'm with the Coalition on Human Needs, and I want to tell you about our perspective on this. If we get the right slides, the point that I'm trying to make is that in the thought experiment that Anne talked about, where the two options were we do nothing or we have a reasoned approach to a solution to our problems, there is, as Andy Stern pointed out a few moments ago, a third option, which is a very real issue of what we're facing, which is that we make the wrong choices. You don't see it there? Something that the high cost was the name of the beginning of the under presentations. Yeah. So the wrong choices are what we're seeing right now. And I was asked to talk about the consequences for children. And for us, the consequences are not only the moral considerations of the sacrifices that we ask our children to make, but the consequences that those sacrifices have to the economy as a whole, and in fact to our ability to reduce the deficit in a sensible way. And so some of my first slides talked about finding it, well, okay. Talked about data that's available, some of it very newly available, that summarize a body of research about the consequences of poverty to children. And those consequences include, obviously, worse performance in school, health problems as compared to children. The comparisons made were to children and families with incomes of above 2 times the poverty line. Right now, that would be about $44,000 a year for a family of 4. If you compare that income level to children living in poverty, many bad outcomes that haunt them for all their lives. And again, those have to do with their health, their development, their ability to perform in school, moving onward to their ability to do well and be productive in the workforce. So this has consequences, again, not only in our moral standing as a nation. We are still, despite all of the pessimistic things that we've been hearing about, a very wealthy nation. We have now 1 in 5 of our children poor, with projections that in the next few years we may move to 1 in 4 of our children poor, 1/4 of our children. And so we're talking about a very large segment of the population that if we do not take the steps necessary to prevent those high levels of poverty and to remediate the situations of children who are now poor, that it will depress, constrain our ability to have productive workers who contribute to our economic growth, who pay taxes and reduce our deficit. Now, we participated with the Deficit Commission. We worked with our members and people around the country. We created a letter that was signed by over 1,000 organizations nationwide, and it was addressed to the Fiscal Commission, and we said, whatever you do, don't do it on the backs of the poor. Hold the poor harmless from your decision making. really for the reasons that I expressed. Also, for the reasons that have been expressed by some of the prior speakers, since 1976 or thereabouts, the increase in incomes for the bottom fifth, about 11%, the next bottom fifth, about 18%, but the top fifth, I forget, hugely more, and about 250% or something for the top 1%. So that widening gap, when you talk about shared or unshared sacrifice, the lowest income have been sacrificing a lot for a long time. So it's not equitable, obviously, to train the engines of deficit reduction on the lowest income. And it is, as I say, also very damaging to us. So we said to the Deficit Commission, protect low-income people in your decision-making. Have a balanced approach that looks both at revenue increases from equitable sources, looks at, and other speakers have talked about, issues like military spending and other tax expenditures that, as John just said, are so disproportionately beneficial to the highest income groups. Have a balanced approach. And we got a very thoughtful and polite response, and we were assured that, yes, they would protect the low-income people and they would have a balanced approach. And the Commission, to a great extent, tried to act on those principles. And now we look to see what's happened in Congress in terms of the balanced approach. And that's where we become very, very alarmed. Because whereas there was an appreciation that we are in the middle, or let's hope a little past the middle of an economic downturn that's very painful, our economy is still in a very fragile situation, that we should not precipitously engage in the budget cutting that would make our situation that much more problematic. But Congress is having a hard time with that. They are wanting to show how serious they are about deficit reduction, and they are focusing not in a balanced way, but 100% at the discretionary, the annual appropriations, and the domestic appropriations. And in particular, of course, I'm talking about the House Fiscal 11, get through the end of the year, budget cutting measure, which even increases military instead of decreases it. And if you see my slides, I have many examples of, the 218,000 kids cut out a Head Start, the 9 million, I believe it is, or something like that, people who will lose their community health center benefits, who would be certainly include children. The 20 million people, of which I believe about 5 million are children, who will lose anti-poverty services because of cuts in the community services block grant. The job training programs for youth either totally eliminated, Youth Build, for instance, which is a very successful program, getting young people into education and construction trades, totally eliminated. And all the Workforce Investment Act programs, including youth programs, stopped dead until a year from this July, if that budget were to become law. And we saw yesterday that the Senate voted against that, but we also know that's not the end of the story, that there will be further negotiations and there will be hostage taking as we get close to the next round of the government's going to shut down or not, or the debt ceiling is going to be reached and will somebody do something about it. Sometime back we wrote something about, what the nation needs is a hostage prevention initiative, because it is the lowest income people and the children who are penalized and are really the ones especially taken hostage. So for us, that third option of it's not just doing nothing, it's doing something wrong that hurts children, that hurts other vulnerable, low-income individuals, and does so in a way that is not just their pain, but that constrains the possibility of economic growth for the rest of us, for all of us, for years to come, that makes that a very dangerous option and one that should be rejected. It is not the only alternative, and that is the most important thing I could leave you with. There are plenty of revenues. There is a slide I could have shown you that would show that if we eliminated the Bush tax cuts, the 2001-2003 tax cuts, and I'm not just talking about the ones for the upper income, but for everyone, that in itself would basically take care of the deficit problem, at least not forever, but for a considerable period. That's not an easy choice to make, to get rid of all of those tax cuts. If we were to get rid of the tax cuts that we just extended for the upper income, that's about $40 billion a year. There's lots that I talked about that was eliminated, slashed, that could be protected and even invested in so that children could get out of poverty. Similarly with military spending, the Fiscal Commission did a great service in identifying about $100 billion in military spending a year that can be looked at for cuts. There are many alternatives that protect our ability to be the America that we care about and want to defend, where we do not set in stone, cement rising inequality, but yet give people the opportunity to contribute both to productivity and a fiscally sound nation for the future. Thank you.
Thank you. I think of this as the where the rubber hits the road panel for the topic of the day, and Debbie just gave a very eloquent discussion from the point of view of her constituency, her very deserving constituency, of the potential costs of doing something wrong, and I happen to agree with you on that, and just to be frustrated beyond belief at the way we're talking about this 12% slice instead of the whole budget, which is the way we should be thinking about it. But let's go back to the costs of doing nothing, and I see really two schisms that are two potential schisms that are exemplified by the panel. One is the haves versus the have-nots, and the way in which doing something, or doing nothing, will potentially affect both of those groups. And are we going to inevitably have a sort of class warfare is the negative way to put it, but the more positive way to put it is whether we're going to have a serious national discussion about the needs of the most vulnerable in society versus the benefits that have flowed to the top of society. One of the things that's really that really impressed me about the work of the commission, and actually really about the most thoughtful work of most groups in this field, is the degree to they've disagreed perhaps about where the line should be drawn of protecting the most vulnerable and how much the middle class should be shielded. But it seems to me that there is sort of broad national agreement, not necessarily about where you're going to take it from, but about spending the money to protect the most vulnerable. You may not feel that way in light of that broad national agreement might not be as broadly shared in the current House of Representatives. But one schism is between the haves and have-nots, and clearly doing nothing is going to force us to confront that schism, as Ryan's slide showed. The entitlements eat up and interest eats up the rest of the budget. The other schism is generational, between the millennials and the greedy geezers that John represents. And as I get closer to,
I would object to that.
I know you would. And as I get closer to geezerdom, I'm feeling really pretty good about the notion that we can't really touch any benefits for anybody. I've got 3 more years till I get to 55, and so I'm definitely in favor of protecting the benefits for people over 55. Is it so? All of that is a sort of provocative, sorry, John, way of saying, is there a win-win here, or is it just absolutely inevitable that we're going to have to confront both of these fights or collisions of needs between the better off and the worse off? And I guess more particularly because I think the answer to the first, you can argue about how to do it, but we're going to, where the answer has to come out, and between the younger generations and the older generations. Since I tweaked you, John, you get to go first and tweak me back.
I do think, as I said earlier, that the have-not thing is very important to any sense of fairness. Now, the question is, where is that line? President Obama has drawn it at 250,000. That's one definition. I think a lot of people are now saying, well, that isn't quite enough to protect my family's standard of living. We're not going to solve this problem if we exempt everybody in the country at 250 and below. So I do think that the work of the Commission was very useful in identifying spending through the tax code that's very top-heavy. And that's one way to do this, but ultimately we're going to have to look at changing the structure of revenues itself, whether it includes a consumption tax or whether it just goes to rates. On the generational point, I think that is an idea that's rejected by the public. I know that some people talk that way, but when you talk to people, they think in terms of family, and they think in terms of family as inclusive of children and grandchildren. I know my members do. And the idea that you're pitting one against the other is a foreign idea that alienates many people. That's not where they want to go. They want more inclusive, certainly language, but also policy. So, for example, they're not really thinking just of Medicare. They think everyone should have health care. They're not thinking just of Social Security. They think that the family that loses a breadwinner should have an adequate life insurance benefit, or somebody who's disabled, who's younger, ought to have insurance to protect their family, regardless of age. So I think it's very important how we talk to people about this and then how the policy follows.
Well, I certainly agree that, at least from my perspective, that taxes need to be looked at. And I think we need to reform taxes, and I think the Commission had a couple good proposals. But from a generational standpoint, my sort of presentation centered around investment, and I really think that, I'm afraid, And I think for my generation that we're not really going to have, we talk about jobs now, but I'm really afraid that we're not going to have very many jobs in the future. We're just not growing and we're not competing. And so we really need to shift our thinking as to how are we going to make sure that we're there. Because we can pay, we need to make reforms to our entitlements, but we can pay them if we have a tax base to pay them. And so I'd like to see us change the way we're spending. I think that the last panel talked about productivity and we don't measure the government in terms of that. That would be great. The GAO report that came out, I think, had a lot of good suggestions. I think we should really look at making government more efficient. The president's talked about that. Whether or not we'll actually see it is another question.
So you don't see an inevitable, your guys aren't going to be on one side of the barricades and John's on the other?
Well, I don't know that, but I do certainly feel right now that we're being asked to make all the sacrifices, because I don't see any action being taken right now. I mean, we can't get Congress. Congress is primarily older than I am and older than a lot of my, and they're not making the tough decisions. And earlier, I think Derek talked about, well, it looks like that they're going to lose their jobs. Well, in the end, I don't really care because I want to see them do something. And I think they're supposed to be leaders. They're out there to help the country, and they're not doing what they're there to be doing. And if it means you're only there for 1 or 2 terms, then that's fine. But you gotta fix this problem.
Debbie?
I think that older people are very interested in protecting the younger generation. That I don't see out in the public this kind of conflict that this would be a bad thing for me to get started on, but I am a totally besotted grandparent, and I want a wonderful future for my grandchild, but I also want it for everybody's grandchildren and children. And I do think that the public also, not just in the generational area, but the have-not. One of the things I thought was interesting in Stan Greenberg's polling recently is where many of us have worked hard for a while to talk about how every kind of social service that we're interested in provides jobs, and it's going to lead to jobs, and let's just talk about jobs because that's what everyone cares about. And yes, everyone does care about jobs, but the way the public was answering the questions, the most persuasive in terms of getting people to oppose what was then the House plan for Fiscal 11 was a statement that talked about the harm that would be inflicted on poor people. And they used the word poor. And that was the most persuasive of all of the different arguments. So I think that people are understanding that that's a wrong choice. It's just morally wrong, and people can be appealed to on that score. But I do, and I think that people want to be appealed to, that their spirit of their public spiritedness can be appealed to, as long as they feel that there is some fairness. That John also talked about, if you see, whether people know the specific fact, but that millionaires average $130,000 each in their tax breaks every year, and you know that you don't have an income that is even half of that, you're not going to be very open to being asked to shoulder all of the costs of what has to come. But if you do see some even-handedness, I think people have some pride in their willingness to share in rebuilding and restoring this nation.
Well, so I want to push back a little bit on some of what was said. And I will stipulate that the greedy geezers of which I'm a pre-geezer, are also, and I really hope I'm a pre-grandparent, not too soon, but soon enough that I get to see it, are also doting grandparents who care about the future of their grandchildren, and are also decent citizens who have an understanding that government has a role in protecting the most vulnerable. And so when you ask them, do they want health care just for themselves or health care for all, they're going to say, oh, yes, for all. And they want services not just for themselves but for all. But that is not the current state of fiscal reality. And the charts that were up and that are kind of seared in all of our minds show the degree to which Medicare costs, above all, are the ones that are, and the associated interest costs, is the cost that is eating our budget, and it is eating our budget, if nothing is done, at the inevitable expense of your needy, young and old, and at the inevitable expense of your more productive investments. So is that something that, and if you look, for example, at the polling in the aftermath of the passage of health care, seniors saw what was being asked of them, which is a lot of Medicare money was being taken out of the budget, and they were not happy with that result. So what is the way out here?
Well, the way out is to go forward with the Affordable Care Act and make sure that everyone has a right to health care. And that is going to be expensive. But on the other hand, it's the only way to get control of the system and then to start making it much, much more efficient. And there are a lot of things that need to be done. I would be on the more radical side in terms of the pace of change or the extent of change, particularly when you look at how we stack up to the rest of the world. We spend so much more and have nothing to show for it in terms of comparative advantage. Part of that is we pay people unconscionable incomes, frankly. Part of it is inefficiencies in the system and paperwork. Part of it is so much of what's provided is unnecessary. And there are ways to attack all of that. Right now, that's not what the debate's about, though. The debate's about cutting back even further on Medicare and Medicaid, the least generous programs there, and their costs are being driven by system-wide healthcare. So, the worst outcome would be simply to shift costs more onto everyone else and raise the cost of working people's healthcare by cutting back on Medicare and Medicaid. That's exactly the wrong approach. So this is really important to get right, and I think this is what goes way beyond the 12%. This is what's really important to the fisc long term, is healthcare, and it's the debate we're having now. It's the most consequential, it's the most serious, and that's what we should be paying attention to, not domestic discretionaries.
Well, I think that certainly we want to make the system more efficient, and I think that's probably our best option. And I don't know what we're going to do for people that are on Medicare and Medicaid right now, but I think looking forward to looking to younger people who will start to receive that program, we should probably focus more on preventative care and really look at health in a larger sense and people living healthier lifestyles and what is leading to the fact that we're in the hospital so much, we're at the doctor so much when we're older, and how can we prevent that, and maybe that's going to help drive down the costs in the future. It's something I really have not heard too much about, and I think certainly expanding Affordable Health Care Act, that's a great thing to have everybody have access to health care, and I'd like to see that situation, but I don't know how we expand the system so much and then decrease the cost. I'm still having trouble figuring that out, and so I'd like to see efficiency and preventative care.
Debbie, did you have something to add?
Yeah, I expanded quite a bit, but to relate to that, a little less than a year ago, I went to Utica, New York, where they were having a poverty symposium, and well, they might, because I believe their child poverty rate was about 40%. And I heard a lot of talk in that meeting, and they were just about to get a community health center. They had never even had one before. But they were talking about going into a 5th grade class and asking the kids if they knew anybody who had diabetes, and, you know, a third of the hands went up. And so the consequences to healthcare needs and costs of allowing those kinds of unconscionable poverty levels to exist, there is a direct relationship between the obesity and the poor nutrition and the healthcare costs, and that's, you know, what I mean by saying, by visiting the pain of deficit reduction on those who can't afford it, increasing the numbers of poor or making their situation more harsh, will have consequences that we'll all pay for.
Let's try to squeeze in a few questions. I think I've proved myself a liar by saying we'd get to a lot of the questions. Sir?
3 points. Rick O'Sullivan, Change Management Solutions. We work with nonprofit organizations. First of all, one lesson I learned from the recession is there are no libertarians in the unemployment line. That everyone's in favor of spending it in the downturn, but as you pointed out, Ms. Weinstein, Keynes was right. In an upswing, you're supposed to save the money, but in an upswing, as revenues are going up and demands are going down, politicians use that money to buy votes, either through more programs or lower taxes. How do you prevent that? As we start to climb out, what sort of triggers can we put in place that will keep the cupboard from being raided again? That's one. 2, the question of the federal government, the federalization of the social safety net is becoming the provider of last resort. The federal government cuts its revenue sharing to the states cut it to cities and towns eliminate health care centers, and people wind up on Medicaid. So it comes back, and the federal government is becoming a larger player, not a smaller player in the social safety net, and you can even expand the social safety net to Libya. This most recent issue of The Economist, on one page, The Economist complained that the U.S. government should be cutting its defense budget because it's bigger than the next 20 combined. Flip forward to the page on Libya, they say there should be a no-fly zone, and of course the only person who could possibly do that would be the United States. So where do you break that cycle and get the understanding that the federal government cannot be the provider of last resort? And finally, to get down to what we're supposed to be talking about in terms of personal responsibility, personalize it, where does accountability come in? Wellness was mentioned earlier. We're talking about addressing healthcare costs, and that can't be done until people understand that healthcare is not something you get, it's something you do. And when you have obesity rates tripling in the course of 15 years, how much can actually be done about it? When you have, in terms of ARP, growing numbers of people who are retiring who have not bothered to put nest eggs aside, I'm not talking about the very poor, but the middle class, who are retiring with $50,000 in their pockets. And last year, there were 30 million jobs created. The problem is we don't have the skill sets. How do we get people to understand that they need to be responsible for their own careers and not expect the government or their employers to manage their lives for them and still succeed and not wind up unemployed and unemployable?
Nice narrow question. Well, let me just take one piece of it. We're probably the country most reliant on individual responsibility in the OECD. But when it comes to healthcare, a very significant part of that is environmental. A very significant part of it is genetic. I don't think blaming patients is a good policy to go at. And in fact, we impose more cost sharing on patients especially Medicare patients, than any other health system in the world. So I don't think moving in that direction is going to be a positive way to deal with the challenges we face in healthcare.
Let's try to get in another question unless somebody had something they were dying to say here.
No, it's okay.
Back there?
Dave Oxter, Research Institute for Independent Living. I do public health issues. And, my question is, making the human side of the physical crisis work for all. And the role of government is to take care of the health and safety of the people. And when we look at population-based health data, comparing the United States to other countries in the world, I mean, we are really low when it comes to mortality and morbidity data. And my question is, how does this physical crisis address, our real low standing in the world on the mortality and morbidity measures?
How does the fiscal crisis address that?
Yeah.
It's making it worse. We're getting worse outcomes now because of the increased poverty and hardship and people's loss of health insurance as they become unemployed and all of that. So the current fiscal crisis is making things worse. There have been some, and the government, while obviously there are some, especially federal programs in place to reduce the severity of that, at the state level, the cuts are, meaning that there are fewer options for people. So, so to turn that around, which I don't really pretend to have the wisdom to have the full solution, does require stepping up to the plate to make the investments that other people on the panel have been, and others today have been talking about, to revive ourselves.
Should we try to squeeze in one last one? Somebody who hasn't asked a question before in the woman back there. Are you a woman? I just can only see the top of your head, so I don't want to get myself in trouble.
Mr. Author, I'm a retired budget committee economist. I have been feeling a need to get back to the original premise of these papers, which is the cost of gridlock. And if you read the paper about the cost of gridlock, it looks like everybody would be better off if we didn't have gridlock. But it does occur to me that often when you have gridlock, it's because there are some people who will be better off with gridlock. And I'm wondering if our approach to this, if this paper shouldn't emphasize those who will do just fine with the status quo and those who might even make a lot of money over the next fiscal crisis.
Anybody want to, since you're going to be around for the fallout if we do nothing, Ryan, why don't you take that?
If the gridlock continues, well, I think a lot of it was sort of what I talked about. I mean, if we just sit here and do nothing yet, true, there are probably people right now who are making a lot of money because we're not doing anything. But I think in the future it means that we are living a much lower standard of living. We lose our status as the number one country. We lose our status as the thought leader. We lose our status as the innovator. And that is a situation that I don't want to live in. And that's not the situation. That is not the America that I heard about growing up. That's not what we were told would happen. So if we do nothing, I think that we won't. It will ultimately result in a lower standard of living.
And I think that sure, those who have done very, very well in the current gridlocked environment would continue for some time to do very, very well, but ultimately doing nothing is a lose-lose proposition no matter where you are in the economic and social food chain. So thank you, panel, very much. And we're going to now move on to the Tony International portion